Welcome to the public lecture Bariatric Metabolic Surgery Patients Information about gastric sleeve resection. The statement from the Public Health Lecture of the International Federation for the Surgery of Obesity and Metabolic Disorders, IFSO, said severe obesity is a lifelong chronic disease, whilst bariatric surgery is the most likely method of achieving long-term weight loss and improvement in several serious medical conditions such as diabetes type 2, hypertension, dyslipidemia, osteoarthrosis, etc. But on the other hand, we should not pay the expense of health and nutrition on the weight loss. And surgery is not for everyone who is severely obese. It is a personal decision that requires careful weighting of risks and benefits in the discussion with your doctor, with your surgeon. Regarding balancing of safety and efficacy or risk, we know that there are several different kind of procedures which are more or less on a high risk compared to the efficiency. Today we are talking about gastric sleeve resection. It is that the biggest part of the stomach will be removed and a tube around 10% of your initial stomach volume is remaining. So basically this is a non-reversible procedure, and when we focus on how weight loss on the long term will work, we know that we have to eat less, so we need a restriction. On the other hand, we know that when we eat less, we get hunger, we get appetite. And in addition, we all know that we should reduce high-calorie food. So the absorption and tolerance of fat and sugar is also essential. The gastric sleeve resection is extremely effective in getting early full. In addition, because the stomach is removed and the part which creates hunger and craving, this part is gone. So therefore, the help and the assistance of having less hunger, less appetite is very effective in gastric sleeve resection. While on the other hand, we can theoretically get fat and sugar such as chocolate, sweets. We can eat them even in a small tube. The average weight loss on the long term, that will mean minimum 5 years, is in between 40 to 60% of your overweight, depending on different kinds of indications, which we did study in Austria. Nevertheless, whenever we speak about surgery, we have to talk about complications, respectively unlikely events. Complications like bleedings or staple line breakdown, that will mean if this long staple line will break and create fistulas. Reflux, vomiting, motility problems, all these complications can add up to a frequency of about 15%. That will mean, on the other hand, 85% of all our patients are very happy and don't have complications or unlikely events with this procedure. It is very, very crucial to have a proper follow-up. That will mean usually hospital stays in between 1 to 2 days after the procedure. We have our first visit to our patients around 1 week after the surgery, and then it is necessary to have minimum 1 year a follow-up, a visit to your doctor, to your physician, or also to your nutritionist. Even in sleeve gastrectomy, we have to focus on vitamins and nutrition. The post-operative care should be that 14 days you should give the stomach the possibility to heal. That will mean 14 days should be only liquids. That will mean water, tea, yogurt is also allowed. While after the second week we have pureed food, then very soft food that you can chew very well. And that leads me to the eating rules. The eating rules are in future to eat slowly, to chew very well, and to don't drink and eat at the same time, not to volume too much your food intake. In addition, you have to take care that because the stomach is gone, your vitamin metabolism is disturbed quite a little bit in producing new blood cells. Therefore, you should add vitamin B12 as an injection, depending on the dose, every 3 to 6 months. A daily intake of calcium and vitamin D is essential, as we know that in Middle East, for instance, vitamin D deficiency is very common. For the first year where you lose an enormous amount of weight, you cannot eat enough protein usually with your regular meal. Therefore, we recommend a minimum of 40 gram protein powder to your food every day. The statement from IFSO says clearly that obesity surgery is safe, but not cosmetic, and it saves life. We would love to inform you, and if you book an information schedule either in Salzburg or in Dubai at McBody Clinic. +971 4385 5552. I thank you very much for your interest, and I would be pleased to take phone calls for information schedule and emails. Thank you.